Good morning, everybody, and welcome to today's session on health and wellbeing in the healthcare workforce. My name is Emma Wadey. I'm the Deputy Director of Mental Health Nursing for England, and I am also a mental health nurse and practicing clinician. We have some fantastic speakers joining us this morning who will be sharing both their personal and their professional experience and knowledge on how they have personally maintained their own well-being and those of colleagues and the wider communities in which they live. We really want this to be an interactive session, so I would really like you to use the Q&A as an opportunity to share comments, thoughts, and also some questions, because there will be time at the end of today's speeches to interact with us and really join the debate about how we can collectively improve the health and well-being of ourselves, of the people we work with, and ultimately the patients and the people that we work alongside and support. So my personal reflections of health and well-being, and of course during this ongoing COVID pandemic, there has been a real light shone on the emotional burden and toil, particularly experienced by those working in healthcare, but also those working in social care, public sector, and actually the emotional burden and toil that all of the public have felt in managing both loneliness, grief, bereavement, fear, anxiety. And I don't think there's ever been a time, certainly in my 25 years career, that there has been such an increased awareness of our own mental health and the impact that has on us and others, but also on thinking differently about how we can collectively improve the health and well-being of ourselves and others around us. Personally, I probably haven't always paid attention to my health and well-being throughout work life. What I have always done is sought out opportunities to make life have more joy, and I probably haven't recognised that that impact has also meant that I've been the best me at work and really been able to drive through not only improvements, but also really inspire colleagues around me and maintain some level of resilience, whilst also obviously looking at that work-life balance. So throughout my career, I've sought out opportunities, both locally, regionally, but also internationally, really thinking about how I can learn from others and bring that learning back. As my career has progressed and I've started to focus more on the health and wellbeing, particularly of the healthcare workforce, and my special interest around suicide prevention, I've become more aware of the emotional burden and toil of the work generally has on my colleagues, and particularly around the high levels of suicide, which we experience here of female nurses, which is a global phenomenon, but has recently been highlighted again in the UK as female nurses being at very high risk. And there are a number of factors for that, work and the emotional burden and toil of our work being just one. So during COVID, particularly, I've been tasked with working alongside colleagues nationally and both in my clinical practice to think about what can we collectively do to support the health and well-being of staff, knowing that actually when we look after our health and well-being, we actually are able to provide better care to our patients. I've had many conversations with colleagues about what that might look like, because very often we will come up with ideas and we will do too, rather than thinking actually what would be of benefit. And there were some key themes that came from those conversations, which really resonated with me and the way that I've practiced throughout my career. And those are three drivers, I think, that were collectively suggested at a previous webinar run by TET just a few weeks ago. And they were the importance of relationships and the importance of networking. So not just relationships in your team, but the networks that we've built around us, both locally, nationally, globally, professionally, personally. And the ability to reach out to others, not just when we're struggling, but to reach out to others to share ideas and to share learning. Certainly during COVID, what I found particularly helpful was linking with colleagues across Europe who were experiencing the pandemic, perhaps at an earlier stage than we were at that time, to really understand and hear their perspective on what was to come, but also what would help. And that really enabled that global connection to help us put things in place early to, as far as possible, prevent future harm. And of course, harm wasn't completely eradicated, as we know, but it meant that we were slightly ahead in being able to put things into place. We know that safety is also critically important, and there was a lot of fear about making sure people had access to the support they needed and the equipment they needed. And the final critical factor that was fed back was that nurses, particularly those that I spoke to, wanted to be part of the transformation of care. They wanted to be seen to be in control, and in control of their environments, in control about supporting themselves and others, but really part of that journey and story not to be done too. So one of the things that we did in the UK was around developing a new role for nurses called the Professional Nurse Advocate, which was about ensuring nurses were able to facilitate restorative clinical supervision, which is a way in which conversations are facilitated that focus on how the work makes us feel and how collectively we can work through that, as well as thinking about how we can work together to improve services, to improve working conditions, and to think differently about how we learn. Also really important was about bringing joy back to work. The work can feel relentless, and probably none more so than during the pandemic, when all of us have been stretched into working in areas we haven't worked before, working in ways we haven't worked before, and this conference being one in terms of the new virtual platform. And there was a real absence in the things that can really sustain our own well-being. And that's what made me reflect back on those networks that I was able to draw on, that I had developed throughout my career, and many of those being across with colleagues and workers in not just other sectors, but also other countries, and how important that has been in sustaining my joy in work. Going forward, our vision is to roll out the Professional Nurse Advocate role across all healthcare settings, which it is already in place, so that 1 in 20 nurses will be trained to have those skills and to have those confidence, to have those health and wellbeing conversations, but also to have conversations about making improvements, about being empowered and able to speak up and make the difference. But also, for me personally and professionally, it really has re-motivated, re-inspired me to think about how do I enable others to have the same opportunities that I've had to collaborate, to link, to network, to volunteer. And a personal reflection around the role of volunteering and how important that is, even within a workforce that can be seen to be stretched beyond the limits. It was really shown to me in 2 things. So the Professional Nurse Advocate programme is a master's level programme of 10 days learning. It's a huge commitment. And yet we were able to engage with nurses. So 1,700 nurses are already trained in 3 months in this programme, during what might be classed as the most difficult time in their careers when they are already burdened. However, the opportunity to feel valued, to gain more satisfaction, to know they've been invested in, and for them to be able to then be in a position to support others, brought them joy and more increase in morale than might have been expected. I also know that for me personally, volunteering, vaccinating, gave me joy at a time when actually it was very difficult to see the difference and the impact I was able to make. I'm going to pause there because I need to share and move on to our next speakers. And I have the absolute pleasure of now introducing Joanne Smithson, who's the Head of Implementation and Learning at What Works Centre of Wellbeing. And I'd just like to take this opportunity, please use the Q&A function, as I say, to post any comments or questions that you might have to the wider panel. But I have now great pleasure of introducing you, Joanne, so welcome.
Thank you very much, Emma. Oh, there are 2 pieces that really struck me from your work there, Emma. It was about how work makes us feel and how do we bring joy into our work. And I hope in the 10 minutes I'm going to chat to you today, we can explore some of those in a little bit more detail. So hopefully you can see that okay, and it's nice and clear. I'm Joanne Smithson, and I'm with the What Works Centre for Wellbeing. We're the UK's national body for wellbeing evidence and practice. We're an independent centre. We work with a range of universities and with a range of funders as well. And our role is really about understanding what makes a difference. So what actually works to improve people's wellbeing, for who and in what context. So I think if I was to ask you all, if you were to Google well-being and use your sort of local, so in my case, my google.uk, what would come up? What would be the pictures and images that we would see if we were to Google well-being? I think in the UK, I would probably get, probably people doing yoga. It's always people in white doing yoga. I might get some fruit and vegetables. But, there's a real perception, I think, out there that well-being is fluffy. And what I want to show to you today is that there's some real science and understanding about well-being. We can measure it in ways that are quantitative. We can measure it in ways that really show that well-being is personal and subjective. So what matters to me and how I feel about my life is what's important. And we can show how we can do that in a real robust way. So well-being is personal and subjective. It's how we feel as ourselves and how we experience our lives. There's lots of things that are important drivers of well-being. So if I think in my life, it's about my health is really important to me. So my ability to do the things that I want to do. My relationships are important. So that's my relationships with my family and my close partner relationships, my friends, but also my relationships at work are a big part of what affects my well-being. And my job is also really important and gives me a sense of purpose. So there's lots of different things that matter. And you'll have your own things that affect and drive your well-being as well. And the really important thing, as this lovely picture shows us, is that we can't just tell by looking at somebody how they're doing. We need to ask. We need to listen really intently as well. Sometimes we get very, very confused with concepts. And I do myself still, and I work in this research area. So I would say it's very easy to get lost in it all, but there are two things that I hang on to. The first one is that mental health and well-being are different concepts. So you can see on one sort of axis of this, we've got mental illness. So from having a high burden of mental illness and not, and then well-being as well. Mental health refers to a spectrum of experience from good mental health to mental illness and distress. Well-being is broader than that, so it includes our physical health, our social and our economic experiences as well. When we talk about well-being, there are three different types of well-being that I like to talk about. So the first one is our mood. We sometimes call this the affective bit. So how are we feeling at this moment? The joy, the pleasure, the happiness. Yeah, it's our positive mood. The negative element of that, so anxiety, despair, fear. Yeah, so that's the mood, that's the in the moment type of well-being. There's a second part of well-being, which is about our life satisfaction. That's sometimes called an evaluative measure. So overall, how are we doing? How does it feel? How happy are we with our lives? And the third part of well-being is what we call this eudaimonic idea. It's this idea of a life well lived. Is our life one that brings us purpose and meaning? Yeah, so those three areas, our mood, our life satisfaction, the evaluation of how we're doing, and purpose and meaning. And there are questions that we can ask robustly to measure these elements. We've been measuring well-being, individual well-being in the UK since 2011. We've got a long sort of data set on this. And you can see these are measurements because we measured it weekly during the pandemic, how that changed. So we can see our life satisfaction, so how satisfied are you with your life, changed a lot from the pre-lockdown levels, the dotted line, right the way through the pandemic. The mood ones, so our positive mood and our negative mood, these move more quickly and more rapidly. They're really quick in response to what's going on, so you see bigger shifts. Then the third one, our purpose and meaning, so how are we doing? And actually what you can see is that our purpose and meaning one is still quite a long way from the pre-lockdown level. There's still quite a lot we need to be doing to feel we've got purpose and meaning back in our lives in the UK. So we said there are lots of things that affect our well-being. Some things affect our well-being more than others. So the first one of these is our partner relationships. Really, really important, and trust. Having a job is really, really important. Having a high quality job is important too, but not quite as much as that ultimate having a job. And then some of the flip side of that, so having loneliness and poor health, have a really strong negative impact on our well-being as well. Few things impact our well-being as much as work. It's really important. We know unemployment damages well-being. And really importantly, people don't adapt. So something happens, and even though you might get re-employed, you don't necessarily come back up to that same level as well-being because there are scarring effects. We know it is different in the UK and in the studies that we reviewed that were mainly from high-income countries, that there are impacts by gender and age as well. So well-being is really important to us. And this is a bit of a problem because we are least happy during our working age. So this is our age, and you can see we have our lowest well-being at 48, which for me sort of means there's only one way to go, but that's okay. Picking up on Emma's point about suicide, you can see a really strong mirror here between low well-being, antidepressant use, and suicide as well. So it's really important that we look at how we can maximize our well-being at work. There are numbers of drivers that we use. The most important thing to remember is that people work for people. Our health and our relationships at work are the most important drivers to our well-being at work. But we need to feel safe and secure as well. And that safety can be physical safety, but also psychological safety as well. We need to feel fulfilled in our work. We need to have a sense of purpose. So that's important too. And that can be about having clear lines of responsibility, but it can also be about using the skills and qualities that we have in our work. So I've said not all drivers of well-being at work are the same. And here we see that the biggest driver in terms of its impact and its size is our relationships and having an interesting job. Pay is important, but not as important as these two. And then on the flip side, what has a negative impact, you can see work-life balance and some of those environment factors as well. But if you look at the scale, you can see that's a sort of a minus 0.1, and the plus 0.1 is here. So really, really, they're not all the same size. And it's just important when we're thinking about how our staff are doing, how we're doing, that we recognise some of these. I said people work for people. There's some super studies that the University of East Anglia in the UK has done. You can see these on a website. I'll pop a link in the chat when I've finished, to trusts that have made, and so hospitals that have made good use of people management practices. And we can see where there's good people management practices in place, we have lower sickness absence, more satisfied patients, higher satisfaction, and more staff engaged in their work. So there's real wins for getting the people management bit right. I've talked about good jobs. So what does a good job look like? And these 11 factors are what we've come up with in terms of a good job. So when you're working in your teams, think about how can we bring out some of these in our roles that we do. So you'll see at the top, our relationships is there with our managers and with our colleagues and our patients. You can see having sense of value, the purpose and value as well. Fairness is really, really important. You can do all the interventions in the world to try and improve well-being, but if people don't believe their workplace is fair, the chance of those improving well-being is very, very low. If you want to measure well-being at work, in the UK, we have some voluntary reporting standards that have been developed with our government departments. And again, I can pop a link to those in the chat, but we've got some really robust questions that help you identify those elements of job quality. And just finally, I want to talk a little bit about volunteering, because at the heart of Tech's work is around volunteering and partnering. And we've done some work looking at volunteer wellbeing. So what happens when people volunteer? And we've seen that actually by volunteering, it can have impacts on people's happiness and life satisfaction. It can increase a sense of purpose, and it can also tackle feelings of depression and anxiety as well. So I'd really encourage you to have a look at that report, because there's some really great findings looking at how we can maximise volunteer wellbeing, the things we need to do to make sure that we're not harming our volunteers, and how we can build the evidence base. And I'd love to see this in the health setting in the work that we're doing today. So finally, what can we do? We need to benchmark our wellbeing. We need to measure it, understand how we're doing. We need to map it. We need to look at what actually we're doing to improve it. Is it making a difference, and for who? We need to think about how our jobs are. We need to think, where can we build those high quality jobs and really improve the jobs that we do? And finally, a good job for me is one that provides access and meaning for people to engage in other purposeful activities at home or outside of work. So whether that's volunteering or being able to do things in our leisure time, take up education, for example. And that ripple from our well-being at work can have a really strong impact on wellbeing at home. So thank you very much for today, and really looking forward to our questions and the discussion. Thank you.
Thank you so much, Joanne. That was really excellent, and some really clear top tips for both employers and us as individuals. And I'm sure there'll be some questions at the end, so thank you. Without further ado, I'd like to now introduce Sarah Markham, who's founder and Chief Executive Officer of Calm in a Box, who is going to talk about her work with the police. So thank you, and very much a very warm welcome to you this morning, Sarah.
Thanks, Emma, and morning, everybody. Delighted to be here with you. Yes, I'm Sarah Markham, founder of Calm in a Box. I founded Calm in a Box as a pet project, really, a side hustle to help support me with my well-being a couple of years back, and then moved to build a business to work with organisations to help them create calmer, happier and healthier workplaces. So I'm going to share with you this morning the work that we've been doing with the police around cultural change. So my background is in HR, so leading kind of large cultural change programs. Bear with me while I share my screen. Oh, it's not popping up. Lisa, if you're there, could you share the screen? And I can start talking through what's on the slides.
I'm on it. Just give me a second. If you want to make a start, they will.
Sorry, Lisa. So in terms of health and wellbeing at work, there's lots of organisations that have done many great things around kind of making sure that resources are available and signposting information around wellbeing to support their staff and putting kind of infrastructure in place. But essentially, in terms of actually making sustainable change, behavioural change happen, and helping people feel that they're seen, heard and valued at work, and have that greater sense of wellbeing in terms of what they're doing, it's really trying to understand how to make that cultural shift so the kind of words and the pictures add up. And that was kind of the opportunity in terms of taking on the project with the police, so Derbyshire Constabulary. So we started working with the criminal justice team. And in terms of background and context, obviously police work is deemed high risk when it comes to developing mental health and wellbeing challenges in terms of the work that they do. But also more importantly, in terms of the impacts on their mental health and wellbeing is down to the culture in which they operate. So obviously there's been a lot of talk in the media, particularly recently, around the impact of culture in terms of how people feel about their roles and their time at work, and particularly in the police sector. So on top of that, there's obviously increasing pressure to address systemic challenges, drive that organisation-wide cultural change to deliver those services more effectively at a time when the strain's never been greater. However, in terms of when it comes to wellbeing and people being able to find a greater sense of balance and take care of themselves, there's still a lot of stigma around creating space and opportunity and support to do that. So how do we work with teams and leaders to be able to create an environment where people feel that it's okay to find a greater sense of balance and to take care of themselves and their mental and their physical health? So starting with any kind of cultural change journey, it's really important to focus down on why we want to make that change. So for criminal justice, there was obviously the context around COVID, so supporting people to recover, after the impact of lockdown and the pandemic, and trying to kind of keep running with their day-to-day roles. But on top of that, they're also going through a high change environment, that cultural change that I alluded to within the kind of police context. So new ways of working with the courts, significant changes around IT infrastructure. So the team having to kind of cope with that change, as well as kind of working remotely and dealing with COVID. In terms of our understanding, there was also a feeling that the approach around wellbeing, even with those kind of basic fundamentals around signposting and resources, that there wasn't kind of consistent access to those kind of resources. So helping to kind of establish greater consistency around the approach to wellbeing across the whole team. And also the core philosophy of Calm in a Box is to do well, you need to be well. And it's really helping organisations shift that balance from focus around doing and delivery to caring about the individual and caring about each other. And by achieving that balance, we're much more likely to maintain a higher level of productivity in a more holistic sense. So how do we do this with Calm in a Box? Everything that we do is underpinned by the Calm model. And as I said, this is really about targeting change at that cultural and mindset level so that the behavioural shift that comes after that is more sustainable and much more likely to stick. So it's really working on wellbeing from the inside out. So the 4 dimensions, the C is all around connection, so helping teams and individuals understand how connected they are to what's really important to them and how that aligns in terms of what's important to the organisation, and making sure that those 2 things are working together in alignment for kind of calmer, happier and healthier lives. The A is All of Me Matters. This is really about helping people understand themselves better, but also move to a place of acceptance. So in terms of not pushing away kind of thoughts or feelings. And again, as we said, in the police culture, where there can be that stigma around showing up, you know, as a whole person, you know, the good bits and the not so good bits that we all have. How do we do that authentically in a way where we're not going to kind of fear that there's going to be a negative consequence for us if we do that? The L is Let Me Have Time for Rest and Recovery. So for organisations, this is a huge shift around approaching us, managing our time to managing our energy. So obviously in the world of work that we live in, we're constantly surrounded by so many different things going on, bombarded with lots of different information. So it's essential for the brain to be able to continue to function, that we take regular rest periods for us to be able to continue to be able to do what we need to do. And then the M is Motivate and Inspire Me to take care of myself and others. So it's really about then, how do you put that wellbeing shift into practice and make sustainable change that's going to stick? So in terms of the journey that we went on with the criminal justice team, we obviously understand the kind of criticality around measuring the impact of the work that we're doing. So starting out with a Calm survey to understand how the team felt around those 4 dimensions were playing out within the context of the team at the beginning of that journey. And then it was about really working together with the team to figure out what that change roadmap needed to look like. So pulling together a group of advocates who we call the Calm team that were kind of already very engaged and interested in this topic and making that shift happen. And then co-creating with them that roadmap in terms of different interventions, which is really critical when it comes to health and wellbeing, because not only is everybody so individual when it comes to what works for them in terms of improving their health and wellbeing, there's also obviously many differences around kind of role structure and setup in terms of how and where people are working. So to make sure that the roadmap was flexible enough to be able to accommodate and engage everybody. And then since that, we've been through 2 phases and had regular review and measurement points to kind of check our progress through that journey. And essentially, yes, that journey is sitting in that blue space in the middle and trying to address and highlight whether there are those symptoms around kind of how engaged people are in terms of what they're doing and the team that they're working for. The levels around inner conflict, which often manifest around stress and anxiety symptoms. So how people are feeling about themselves and how authentic they can be in the workplace. Where people are around burnout, so whether there are kind of challenges there, and then also how demotivated people are feeling about, you know, that hope that they can make some kind of positive change happen around greater balance. This was the heat map that we produced at the beginning of the Calm journey. You can see actually there are very positive results in terms of the feedback from the criminal justice team. We had a great participation rate, so I think we had about 79% participation. So really strong results. However, if you move on to the next slide, when we peeled below the surface, so we then ran a series of workshops with the Calm team to get under the skin of those survey responses. responses. And a lot of the positivity around that was the fact that there was a robust framework, support framework in place, and lots of kind of resources available. However, there was that gap in terms of the words and the pictures adding up. So although the resources were there, their kind of ability to engage in those resources and being able to take time out to look after themselves, they felt was very compromised. So again, there was a huge opportunity around working to support leadership to role model the importance of bringing the CALM model and health and wellbeing to life, to give permission to everybody else to do the same. So that was really the sweet spot in terms of the key objective of the CALM programme, to make that happen in practice. So what did we do? We co-created that a blended approach. So just as I said, in terms of being able to have a flexible framework that can accommodate everybody's kind of different needs within the team, and making sure that it was a tapestry of different interventions that were phased over a period of time. So we kind of weren't sort of, coming in with initiatives and then sort of pulling back out again, but they were joined up. And again, that energy and that effort around supporting the leaders to start to role model a shift in behaviour was absolutely key. And we've also looked at building a theory of change out for the work that we've been doing and where we've got to so far. So essentially looking at that tapestry of activities that we put in place to support positive change around health and wellbeing for the team. And the feedback has been really positive. So in terms of the intermediate outcomes after kind of 2 phases of different interventions, which the team felt were the right things to do. We're looking at participants really having a shift around their relationship with their own health and well-being, and importantly a real shift around becoming more proactive. So within their culture, again, there can be a tendency to sort of be on the more reactive side, and again that's one of the cultural objectives I think the police are trying to shift. So being able to really starting to accept and understand that they can take more control to help themselves. We did a lot of work around setting boundaries, which is one of the kind of the key pieces around helping people feel more in control and being able to make better choices around their health and well-being, is to be able to set those boundaries, particularly at a time during the pandemic where a lot of those boundaries had been lost because people were working remotely. It was really positive to see the amount of connection that went on across the CALM team as part of the programme. So being able to really get to know each other better and develop that level of empathy for different individuals doing different roles across the team was a really powerful shift and really positive one. And on a personal level, increased levels of self-awareness and their personal drivers around their own mindset when it comes to looking after themselves. And for the organisation, looking back, it meant that they were able to deliver the amount of change that they needed to deliver. And they also, to be able to do that, they had to complete a lot of upskilling and cross-skilling, which again was completed successfully. And then this final slide tracks the progress in terms of us being able to look at, so when we resurveyed the team against the CALM model, so out of 3 out of 4 areas, we saw a positive shift in terms of those scores, particularly around the A. So again, we talked about the A being that all of me matters. It's that ability to feel that our whole selves are accepted and that we can show up authentically in the workplace and we can express ourselves without kind of fear of incrimination. That was a really significant shift in terms of building relationships and helping people feel comfortable with doing that. And again, we have some positive scores around the individual interventions and initiatives that we ran, which we measure by something called Net Promoter Score. And the qualitative feedback was really positive to see too. So hopefully that gives you a bit of a flavour around that cultural change journey that we went on, and how powerful those 4 dimensions are in terms of being able to create more positivity around health and wellbeing for individuals and for teams. Thank you.
Thank you so much, Sarah. That was incredibly interesting, and particularly I know there will be some questions that we'll pose to you shortly in the panel, and I think particularly around how you change culture. And you could suggest that there's nothing more difficult than a police culture or criminal justice culture around where wellbeing can be seen as a bit soft and fluffy and are nice to do. So I'm sure there'll be some questions around that shortly. Before we move on to the questions, I'm absolutely delighted to introduce our final speaker this morning. And this is Harriet Nyaga, who's a midwife joining us from Masaka Regional Referral Hospital. So welcome, Harriet, and now over to you.
Thank you very much. As introduced, my name is Naiga Harriet from Uganda. I'm a midwife and I'm the founding director of Midwife-Led Community Transformation, MILCOT, which is a community-based organization that focuses on prevention of teenage pregnancies through bridging the gap that exists between the community and the midwife. And we bring sexual reproductive health to marginalized adolescents and young adults. I want to thank TET for this great opportunity to be on this panel to speak on this important topic, because I can say that I'm a success story of the global empowerment that we have had during this period of time during the pandemic. And I'm so glad that I have been able to extend what I have gained to my fellow nurses and midwives in the community, in the country, and in the world at large. I have been so blessed to be empowered by Nursing Now Global Campaign as a young innovative midwife from Uganda through my work, and I have been nominated by International Confederation of Midwives as a young midwife leader. So these platforms have enabled me to get exposed to a huge network of organizations, global leaders that I have been able to bring close to my work, and we see how we do provide services and support nurses and midwives in my community. This topic about well-being of health workers, I just want to speak about it in the context of a nurse or a midwife. In 2020, WHO projected a gap of 9 million nurses and midwives that we need to attain global health coverage by 2030. Unfortunately, we have faced a pandemic that has taken away some of the nurses and midwives, and others have been hardly affected, but it's hard to trace them. I'm just imagining, where is the gap at the moment? No one knows. However, I'm looking at the well-being of the nurses and midwives who are at the moment standing to serve the population that has been affected hard by the pandemic. It's hard to tackle, but if we approach it in a way of partnerships, collaborations, learning from countries, this can be done very well and we can achieve the results. Again, I thank TET for projecting the interest in partnerships and collaborations and how they can support well-being of nurses and of health workers. Still, as an example, at MILCOT, we have carried out at building resilience of nurses and midwives towards services. In this, my vision was to empower nurses and midwives, because for many years, nurses and midwives, we have been lagging behind. We have been underestimated. Our work has been underestimated, and our innovations have not been seen. So MILCOT, in my capacity as a midwife, I said I have to come up to be seen. But however, I said nurses and midwives have to be empowered alongside my journey, because I believe that to achieve well-being, one has to be with a purpose and has to be moved with a vision. And we have to know that life is about the lives that we touch. This has helped me to move through the pandemic, to move through the hard times when my mental health is in proper space. And also, I have helped the nurses and midwifery to help them know when they are getting burnt out, how can they handle the population during this pandemic, and also they have been able to identify their leadership styles. But all in all, we have empowered them how to serve marginalized adolescents and young adults. And good enough, they have been able to go down to the grassroots to provide sexually reproductive health services to marginalized adolescents and young adults. And a total of 922 have been served. We have taught nurses and midwives to do not only concentrate on clinic. I mean, they have learned to bring out their services from the labor suite or clinic to extend them to the community. The results that we have got among nurses and midwives throughout our empowerment sessions, they have been very ambitious. They have got opportunities to network with the global world. They have started going back to school. Some of them have enrolled because some of them had hated the profession because it is not yielding. So they have given us written reports that I have gone back to school because of your inspiration that you gave us. Because of your inspiration, I have now been promoted to this position. Because of your inspiration, I'm now to lead. So what I want to say is that when we get empowered and also consider empowering others, that will be very good. And I think this is the approach that we need for nurses and midwives. Let us, if they get, they are going to be able to share it to the fellow nurses and midwives. In this topic, I feel that it is something that we need to take a lot of time and discuss about, because if we do not help health workers during this time, that means we are not going to achieve anything. Let's not leave out mental health. I have gone ahead to look at the nurses and midwives in Uganda. Mental health services are lacking. And yet this is the time when they need to be supported more. Collaborations and the huge network that I have been able to network, and I have got Jaya Mental Health in Nepal. I have learned from what they are doing, and we are planning that we borrow this initiative and also implement it in Uganda. And at the moment, Milcott is writing a research paper so that we find out the need for psychosocial and midwives. We need to listen to them to hear how do they feel, how have they been affected, what do they have to tell us, because they have not got this opportunity. So if we get their say, we shall be able to get an evidence and be able to provide them with the psychosocial support in support of Jaya mental health. I wanted to show that the collaborations are really very important during this period of COVID-19, because COVID-19 pandemic has affected countries differently. You'll find that in Uganda, we are using different approaches of tackling challenges. And in the UK or any other country, you are using different approaches to tackle the challenges that have been caused by the pandemic. And we can easily borrow these initiatives and they move across countries. So that means we need to stand up and realize the power in partnership. the power in collaboration. This is the only way we are going to support healthcare well-being and also to tackle the 21st health care challenges. I'm glad that I have been able to speak on this session, and I look forward to hearing the questions that will come along. What I can't leave is that through my work, I have been exposed to a number of opportunities and have been profiled on many platforms. But the most recent and the huge one is when I was interviewed by Her Royal Highness, the Duchess of Cambridge, when she sat and listened to what I do in serving marginalized adolescents and young adults, and also how I'm supporting the nurses and midwives in my community. I have been able to share all the experiences to over 4,000 nurses and midwives around the globe. And according to the results and the feedback that I get, it means there has been a huge impact. And I hope that if we can get many individuals doing the same, we can have a big change in the global health, starting from the community, just like Milcott is doing. Thank you very much.
Thank you so much, Harriet. And I've certainly written down your power in partnerships, and we'll be using and abusing and taking it shamelessly. Thank you so much for sharing. And I think all of our speakers have done a fantastic job this morning at both setting out the reasons why and the importance of engaging with workforce, understanding our own health and well-being, and the huge positive impact that has on us as individuals, on the patients that we look after, on the communities we serve, and of course on our families. And we've also heard how as individuals, we've struggled during COVID, and how we have collectively come together in our organisations and in our work to make a difference and to actually have health and well-being recognised as a way in which we can support the workforce going forward. But actually, in order to do that, we must listen and we must learn from others and collaborate. We have got some questions, so I'd like to invite all of this morning's speakers to now put your cameras on so that the listeners can see you all. I'm going to do my best to navigate through some of these questions. We have about 20 minutes left for these questions, and I just am going to start actually with one that came to me first, which was around how do we encourage leaders to find joy at work. And I think all of us as a panel can actually touch on this point actually. I think quite often we focus on the barriers in our work and what's not going well, and the global crisis in healthcare worker numbers, in nursing numbers, in doctor numbers, the lack of resources, the things that aren't working. And we can focus also on, as I did myself, on the emotional burden and toil of the work and how that impacts on us and our ability to do our job. But we also know that when we speak to staff, when you ask them why they stay and what has brought them into nursing, into the police, into research, into whatever job we do, we talk about the things that sustain us. And often that is the things that we find joy for, the relationships with our colleagues, the pleasure we get from making a difference, the thank yous we receive. And often we don't focus on those things. It is difficult to encourage sometimes people to focus on joy because it can feel like a nice to do and not a must do. However, there is a growing research body that links increasing joy at work to reducing burnout and stress. And the Institute IHI of Health Improvement actually has got a framework to support organisations and healthcare leaders in working alongside their colleagues and their workforce to think about how do we create the culture and the environment that breeds joy, if you like. How do we make sure that people are listened to? How do we make sure that people feel safe? And how do we make sure that people feel part of the solution? And I think actually Joanne, Sarah and Harriet have all spoken actually about how they have maybe not used the word joy, but actually have supported colleagues to create systems and environments where people can feel proud of the work they do, where they feel valued, and actually they enjoy it, because if we spend a lot of time at work. So I think, how do we encourage leaders? I think sometimes that's about engaging in the conversation, about drawing out with them as individuals what brings them to work every day, and getting them to focus on the solutions. But I also want to invite some of the other speakers to talk about their experience of how they've increased joy in the workforce, and how that's been successful or not. So I don't know, Jo, I saw you nodding. Oh,
I can go if you want.
Yeah, thanks, Sarah.
So for me, it's really important about the role modelling aspect that I talked about. So in terms of encouraging leaders to, so we talked about something called the shadow of the leader. So if the leader's not in a place where they're connected to their role and being fulfilled and engaged in that, that's obviously going to create an environment which shines down on everybody else, which is going to then find them difficult to do the same. And for leaders to be able to do that, they need to have a really clear sense of their own values so they can connect into what's important to them and be looking after themselves first and creating that time to reset and rebalance and protect their own energy so they can show up as their best selves to allow everybody else to do the same. That would be what I would say.
Thanks, Sarah. I don't know, Joanne, if you wanted to come in there as well.
I'd written visibility down there as well. So all my notes you were all crossing off. I think that's it. I think it's the visibility of it. So as seeing leaders bring joy into their work through some of the things that we know from the evidence. So if it's about learning new skills or learning together, there's some really strong literature about how good learning is for our well-being. So by participating in this very webinar today, we know that's having an improvement on our well-being. So I think there's something about visibility. So that could be about clarity and purpose in their roles as well. So either in their social media posts or their newsletters that they do, or just being out and about, sort of checking in on some of those things that we know make a good job. So about being clear and purposeful about your role, feeling valued. So checking in, are colleagues feeling valued? Thinking about the environments that we're working in. So showing those environments and showing how they can bring happiness and joy and purpose and meaning to roles as well. So I think there is absolutely the visibility, and you can do that in ways that, as you said, may not say joy on the title, but we know they're fundamentals to our well-being at work and our job satisfaction, and measuring it as well. So those sorts of questions, and I put a little link in the chat to, does our job help? To what extent does our job give us satisfaction? Do we feel we have a job well done? Do we have the skills and knowledge? And actually being open and transparent about that as well, that actually, I think we have a lot of, as leaders, lots of performance measures, don't we? But actually, having a performance measure in there about how our staff are doing, how are they feeling, how is work making them feel, and really showing that by measuring it, it makes a difference and it matters. Yeah.
No, that's really helpful, Joanne. And I just wonder, Harriet, if you wanted to mention anything here as well, because you were very much talking about the joy that connecting globally has brought you, and also how you've been able to inspire others by encouraging and supporting them to find joy in their work too.
Thank you very much. How can we encourage leaders in healthcare to support colleagues finding joy at work? And I already shared through my own experience. I ever worked in a place where all of us, the nurses and midwives, were not receiving satisfaction at work because of different reasons. Because of pay, especially pay, which does not relate to the amount of work that we offer. But nurses and midwives were not able to speak out. That means there was no conducive environment for them to speak. And while in that workplace, I made a decision to be a voice in my position. I was just a mere midwife, just like any other person. I didn't hold any leadership position, but I utilized my voice to speak to the leaders. And these leaders are neither nurses, no midwives, no doctors, So probably they do not know what we go through. And through my voice, I was able to share openly what nurses and midwives go through, and the amount of pay does not equate to the work. And also how the nurses and midwives are viewed, how the public see us is not respectful. And because they see also leaders do not respect us so much. If they would respect us and respect the work that we do, they would pay us well. So that means leaders need to first learn the type of work that health workers do and see how valuable is it. How much does it weigh? They need to take time. And during this time of COVID-19, it has been evident that health workers sacrifice. They have not sacrificed only during the pandemic, but we have been sacrificing just from way back, from the beginning of our career. It is about giving out our lives for the lives of others. That is enough for a leader to know that health workers need a conducive environment. They need good pay. They need all the necessities, the facilities that they need. They need transport. They need mental health. And most important, we need to be partners. It is a mutual working relationship, but it's not boss and worker. No, it's not like that. They need to know it. Doctors need to know that we are mutual partners with them. We are not there to assist them. And bosses and all leaders should know this from around the world. If organizations like FETS and many others stand up and say, health workers need to be prioritized, that will be the first point. And we also advocate to everyone. However, there is one point that I want not to leave. When we speak, governments listen, but we have a high percentage of health workers in private health sector. And these are left out so oftenly. They do not have anyone to speak for them. And even at the workplace, their voice is so limited because once a person will speak out, she will lose her job and she will get on the street to look for a job. So private health sector, we need to strengthen our voices and advocacy into private health care leaders to know how to handle health workers. Thank you so much.
Thanks, Harriet. And I think you've touched on a number of the questions that had been raised around the barriers for people in being able to engage in health and wellbeing initiatives, but to support the health and wellbeing of themselves and their staff. I wanted to ask or target directly Sarah. There was a question that came to you, and I think all of us were really struck when you were talking, and certainly your data around your CALM program, how initially people weren't that keen. And I guess what Harriet's talking there is, how do you convince and influence people that maybe do not understand the benefits and the wider benefits of supporting the health and wellbeing of individuals and organisations? So I just wanted to know if you could share some insights around how you overcame that.
Yeah, it's a great question. I wouldn't say they were necessarily against the CALM model, because they're actually a really kind of open-minded group. They're a great group to work with, but there probably was definitely skepticism and uncertainty about, the whole it's almost the stereotype that Joanne was talking about around well-being and what does it actually mean. And again, I think the police have tried really hard and they've done great work. They've put a lot of infrastructure in place. There's a lot of resources available. So it was almost like, what is next? But kind of, what we've got is fine. But to what extent are people engaging with it? And it's really that engagement piece that's that sweet spot, and that's why we put the energy into the cultural change rather than creating more initiatives. And I think there's a few things that happened. I think firstly, the strength of the leadership. So the leadership were really passionate about making that shift. both on an individual level and on an organisational level. So they really cared about making the difference, for the organisation and the benefit there, but also for the individuals. They were also were very open about. I remember we had a really open conversation about the stigma that exists within the police culture, and we had an amazing discussion around identifying the be strong aspect of their culture, and how that they did find it difficult to necessarily open up. So although again that support was in place, people wouldn't go and access it because they didn't want other people to see that it was being accessed, or they just felt internally that they kind of had to put up and keep going. So that was a great discussion to start and unlock that. And then in terms of they added as they had 4 pillars set out as part of their strategy for the year, and wellbeing and the Calm programme was the 4th pillar. So I think again with that, really underpinning that passion and commitment by the leadership to go on this journey. And then I think in terms of the programme itself, people found it engaging, and we also built up that dialogue slowly and over time. So again, it's not kind of coming in with kind of one-off initiatives. It's keeping going with a kind of a pattern of discussions where things get developed and evolved, and people are listened to in terms of how that needs to shape up and look.
Thanks, Sarah. And you touched on a couple of areas there, particularly again around stigma. And certainly that was something that we really experience and hear in healthcare, that we're very good at serving others, at putting others' needs before ourselves and our own. Hence why we probably fall into these public sector roles, whether that be police, prison, healthcare. But we are very poor at putting our own hands up when we're struggling, for fear of looking weak. I think you picked up on the word strong, but also what we found in conversations was fear of being reported to our regulators, as well as not being seen to be fit to work, not up to the job. And we had, in England, we had huge investment. We have had huge investment, unprecedented investment actually, in both preventative health and wellbeing initiatives, which are very much tailored towards the individual. And I think you spoke there about having lots of different types of initiatives, because actually there isn't a one size fits all. Right through to advanced mental health interventions and treatment, so the whole spectrum. But actually there was a real fear around confidentiality, a real fear of looking weak, and still that stigma persists, and is probably something that all of us collectively need to continue to work on. The other thing that came up in my work with the nurses actually was also managers wanted to protect their staff. So they put measures in place that they thought were protective, but actually how that was experienced was limiting. And I think that comes on nicely to my question for you, Joanne, because as I mentioned with the pressure nurse advocate role, it was a big ask, but actually we're going to have 1 in 20 nurses trained in this programme within the next 3 years. And we've been absolutely inundated with nurses wanting to do it. But actually there was a fear of burdening, adding more to. And so one of the questions was, obviously TET wants to really encourage the importance and the value of volunteering, and particularly that global network. But actually what might be some of the negatives or perceived negatives that organisations might feel, and how can we use the evidence in our favour or to mitigate that?
Yeah, so there is real evidence both on the benefits and the negative impacts of volunteering. We know, let's flip the positive bit first. So we know volunteering works because it builds our self-efficacy. It builds our belief in our own abilities. It builds our social connectedness. It's the second main mechanism that volunteering improves our well-being. And it increases our sense of purpose. So those are the 3 mechanisms that we know lead to an improvement in our well-being: our self-efficacy, social connectedness, and our sense of purpose. On the flip side, we know that when volunteering isn't done well, it can lead to increases in stress, anxiety, and burnout. So those are the 3 mechanisms that lead to a decrease in our well-being through volunteering. What we know from our research, and I've popped a little link in the chat, is that there's lots of stuff we can do to make sure volunteering is done well. We can think about how we widen participation in volunteering as well, because we know that those with the lowest well-being gain the most from volunteering, but equally that they can face the biggest barriers for being involved as well. So we need to understand how we can support people in terms of volunteering. In terms of how we scope those roles, so our research shows that regular volunteering is better than a bit here and a bit there. But there's that sort of threshold, and where that threshold is, that sort of tips over into having a negative benefit is like well-being, personal and subjective. It depends on the role that you're doing, the intensity of that, the context within which you're volunteering as well. So it's sort of getting that sweet spot in enough volunteering to improve our well-being, but not too much so we feel burdened. In terms of some of the things we can do to sort of structure some really great volunteering roles as well, we can think about the scope. I suppose it's about being able to accomplish your task. So as a volunteer, being able to volunteer, see the task and have that done. So that sort of meaningful activity as well, making sure that the activities we're asking our volunteers to do are meaningful, and as opposed to, it's that having a meaning and purpose. So that's got to come through as well. And being able to, and having the emotional support as well. Often we think sort of volunteers are free, and we're really not. We need to be making sure we have the management and support of our volunteers as well to get that maximum well-being.
Yeah, thank you, Jen. It's really interesting, that point around volunteering being free, because that can then equate to people not feeling valued or being used as cheap or free labour, when actually that's the furthest from the case. That's really helpful. I know that we're rapidly running out of time, but I just wanted to touch on very quickly before we wrap up. And I think, Harriet, you particularly highlighted how significant it's been to you personally around the power of networking and that global opportunity to network and learn from each other, but also to come collectively together as one voice, to really challenge perhaps some perceptions around that health and wellbeing isn't a nice to do, it's actually a must do, because the evidence is so striking that actually healthy workforce provide better outcomes, whether that be for patients or the communities. So it feels a bit like a no-brainer. And I just wanted to invite any of you three with any final points before we wrap up this morning's session.
So I would just really echo that point. Our philosophy is to do well, you need to be well. And it's not, either or, it's both and. In terms of organisations, you get productivity from looking after people. So it's just so interconnected. So it's absolutely critical.
I really like that slogan. We've used, there is no health without mental health. So we're very clear about that. But we've also talked about staff safety equals patient safety. They are the same thing. And that's how we've really started to engage the healthcare workforce in prioritising. I mean, there are a number of key drivers we've used around NHS contracting or our regulators. But actually, we're trying to make it equitable, if you like, that actually to do a good job, we've got to be well in ourselves. And so they are the same thing. And I just wondered, Harriet, if you had any final comments around the power of networking and volunteering and the benefit from particularly linking Uganda with the UK.
Well, thank you very much. In my final remark, I'll say that networking is the only way to move forward. We cannot move alone and we achieve what we want. Different people have different talents. Different organizations have different visions. And when we bring that different visions together, we are going to get a big vision that we are going to achieve. About volunteering, let's carry the power of purpose. I wish if anyone of us in the world can identify her purpose in the world, you will have found your true fulfillment, permanent fulfillment, and you start to create well-being environments for others. But it starts with you, and then you advocate for it, you work for it. And another word for the leaders in the world, governments, I advocate that nurses and midwives make up more than 50% of the global healthcare workforce. So if we are not available, it shrinks. We need capacity building, we need exposure, we need empowerment, we need support in our innovations. Let's work together. See us as potential partners, not as workers on the ground. And then we shall achieve sustainable development goals. Thank you very much.
Thank you very much, Harriet. Very powerful end, I think, to this morning's session around recognising our own health and well-being needs in order to role model and inspire others. The power of understanding the evidence and using that evidence to really shape and influence others. And actually also the power of volunteering and networking, learning from each other. We always have something to learn, but we need to make sure that whatever we do has purpose, it has value, and that actually it does more good than harm. So I think that's all of our questions this morning, unless there's any final thoughts that people would like to share at this point. Otherwise, I'll bring this session to a close and say thank you so much to all of our speakers this morning for your very generous time, but also sharing your experience and your expertise and your work, which is truly outstanding. And also for those of you that have engaged in sharing your thoughts and comments in our chat this morning. So thank you.